Did you know that there are many choices when it comes to preventing pregnancy beyond just abstinence? Let's take a look at some of the different methods available. But before we start, click the subscribe button to be part of this community. Let's get started. First up is using condoms. As most people know, condoms are worn over the penis during sex to catch sperm before it can enter the vagina. When used correctly every time, condoms are about 85% effective at preventing pregnancy. It's important to use latex or polyurethane condoms and to store them properly so they don't tear or break during use. Another popular option is birth control pills. These daily pills contain synthetic hormones that prevent ovulation and thickening of the cervical mucus, so sperm have a hard time reaching an egg. When taken at the same time each day as directed, pills are over 90% effective. Sometimes users report side effects like nausea, headache, or tender breasts in the beginning as their bodies adjust. For those looking for a longer-term solution, an IUD or intrauterine device is inserted by a doctor inside the uterus. It is highly effective for 3 to 10 years depending on the type. IUDs work by releasing hormones that damage sperm. They have an over 99% effectiveness rating. Some people find their periods become longer or crampier with a copper IUD. Another way to prevent pregnancy is by using the withdrawal method. This requires the man to remove his penis from the vagina and ejaculate outside. The effectiveness of withdrawal alone is about 78% with perfect use, but only about 82% effective for typical couples. When withdrawal is combined with condom use correctly, it brings effectiveness up to an estimated 96% at preventing pregnancy. There are also options like the birth control patch, vaginal ring, shot, or implant, which delivers hormones to the body in different ways to prevent conception. Body basal temperature is another method that allows women to track their menstrual cycles and avoid unprotected sex during the most fertile times of their cycle. And of course, abstinence has a 100% rate of preventing pregnancy, and it is also a viable choice, especially for teenagers. The big takeaway here is that different methods suit different people with different lifestyles. If you like this video and want more, subscribe to this channel. Thank you for watching. Bye.